Hello everyone, and thank you for joining us. My name's Michael Fotheringham. I'm the Chief Executive Officer at AHURI, and I'm delighted to welcome you to the latest of events in our AHURI Research Webinar Series. Before we begin, I want to acknowledge that I'm hosting this webinar from the lands of the Wurundjeri people of the Kulin Nation, and I also acknowledge the traditional custodians of the various lands on which you all work today, and the Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past, present and emerging, and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters throughout Australia. Now, AHURI is pleased to be able to offer this research webinar as a means of keeping you informed of our latest research and to help you engage with research findings from our ongoing program of research activity at a time when our public face-to-face conferences and events program is, of course, still on hold. And so today will be our fifth instalment in the series. If you're interested in our previous webinars, the recordings are freely available on the AHURI website. Before we meet today's speakers and I introduce you to the topic for today's webinar, I want to take a moment though just to introduce you to AHURI's National Cities Strategic Research Agenda, which we launched just a couple of weeks ago. As part of AHURI's strategic plan, we've committed to developing a program of research to explore the many issues facing Australian cities today. Expensive housing markets, extensive geographical sprawl, high carbon intensity and resource consumption, rapid population growth, changing transport needs, and of course the coronavirus pandemic. It's our ambition to provide Australian cities and urban policy research with the same coordinated focus, engagement with the policy community and impact that we're currently bringing to the housing and homelessness research area. The launch of this strategic agenda and our website hub is the first step in our journey to deliver a national cities research program. So I invite you to take some time to visit the new Cities and Urban Hub of the AHURI website. It showcases 12 key research themes that we've identified as either defining current cities policy in Australia to date, or that we believe should be considered in our policy focus as a nation moving forward. If your organisation is interested in partnering with AHURI to deliver a future cities research program, we invite you to contact us and start a conversation. Right, before I introduce today's topic and speakers, I do need to provide you with a few instructions on the software and some housekeeping. This webinar is being recorded, so if you need to leave or you're getting distracted by homeschooling stuck in Melbourne, or for that matter, if you want to return to it later or forward it on to a colleague, the recording will be on the AHURI website in the coming days. And at the end of today's webinar, you'll receive a survey. We really do welcome your feedback so that we can refine and improve our future webinars to ensure we're presenting information in a way that's useful to you. Now, in terms of participating in today's webinar, some instructions. You're listening in using your computer speaker system by default, but if you prefer to join over the phone, just select telephone in the audio pane and the dial-in information will be displayed. You'll have the opportunity to submit questions by typing them in the questions section of the control panel, and you can submit your questions at any time during the presentation. We'll collate those and address as many of them as we can during the Q&A segment following on from today's presentations. But do please disregard the raise your hand functions. We won't be using that today. Now, today's topic and presenters. I'm delighted to welcome you to today's webinar, Social Housing Pathways in Australia. Our presenter today is Professor Kristy Muir from the University of New South Wales, the lead author of AHURI's report, A Pathway to Where? Inquiry into Understanding and Reimagining Social Housing Pathways, which is the basis for today's webinar. This study investigated how social housing pathways are conceptualised and constructed by housing policies in Australia, who's moving into and out of social housing, and what is the lived experience of people who've moved into, within or out of social housing. The report, along with a policy evidence summary and a standalone executive summary, is now available at the AHURI website. The address should be on your screen now. Alongside her role as Professor of Social Policy at the University of New South Wales, Kristy is also the CEO of the Centre for Social Impact and a member of the New South Wales Premier's Council on Homelessness. Her research spans housing, education, employment, social participation, disability, mental health, financial resilience and wellbeing. We also welcome Fiona Caniglia as a respondent following Kristy's research presentation. Fiona is the Executive Director of Q Shelter and has been involved in various committees and working groups striving for housing and homelessness solutions since the 90s. Fiona has extensive experience across government, community services and private industries. And we look forward to hearing her thoughts on the research after the main presentation. So it's now my pleasure to hand over to you, Kristy Muir.
Thank you very much, Michael, and thank you to AHURI for the invitation to do this, and thank you to all of you who are listening wherever you might be based. And on that note, let me acknowledge the Indigenous people and countries wherever you might be. I'm sitting on Dharawal country here in the southern suburbs of Sydney, and I'd like to acknowledge the Indigenous people as the traditional owners of this land and pay my respects to elders past, present, and of course emerging. And for this particular topic, let me acknowledge that we have a long way to go to close the gap in terms of Indigenous housing to be safe, stable, affordable and appropriate. Let me also just quickly thank and acknowledge a couple of other people before I kick off. One is all of the social housing tenants who spoke to us as part of this research, the housing provider staff who also contributed to this project, and most importantly, my co-authors, Abigail Powell, Kathleen Flanagan, Wendy Stone, Selena Tully, Debbie Faulkner, Chris Hartley, and Hal Paulson, who all played really important roles in this research. So I'm here giving you the findings, but they did a whole lot of the work. So thank you to my co-authors. Okay, let's kick straight off and talk about where we start in terms of what problem are we trying to solve here. Next slide, please. So many of you who have dialed into this will know we have a fundamental demand and supply problem with our social housing. And on the demand, the big picture equation here is that the demand for social housing in Australia significantly exceeds supply, hence my seesaw being weighted down at one end. From the demand side, in 2018, there were almost 200,000 applicants on the wait list for social housing. And that doesn't count the hidden numbers of people. So the rough sleepers who aren't counted in this list, those on very low income households who are in housing stress, we know that is around 3 in 5 of that group of people. Those who are temporarily suspended from existing wait lists. And we also know that the demand has increased substantially over the last couple of decades in terms of housing affordability worsening. And of course, in recent times with COVID, we'll see that get worse. On the supply side, we have seen social housing dwellings increase, but not at the rate of growth that households have grown. And so the number of social housing dwellings per 100 Australian households has declined over time, as well as this, at the same time, counterbalance of the demand increasing. We've also seen, which is not surprising given the drop in dwellings per household numbers, a decrease in government expenditure on social housing over that 5-year period of around 7%. So the result really is that the availability of housing stock has outpaced the number of households who are experiencing housing affordability problems and who need social housing. Next slide. So given these problems, the research inquiry tackled 4 big questions. We wanted to better understand how those pathways into, within and out of social housing were conceptualized. So how do we even think about those pathways and what do they mean? And how is that translated into policy across different jurisdictions, so different states and territories around this country? Who's moving into, within and out of social housing and why? How tenants actually experience those moves? And how social housing pathways could actually be reimagined for more positive outcomes for our current and our future tenants of social and affordable housing, and how we might reimagine that system. So I guess it's probably also just worth quickly saying, you know, when you think about pathways, think about the mobility of households. So how households might move and what those pathways might look like. So those residents who are potential residents or current tenants, how they move within that housing system. So without any further ado, and any of you who are really interested in methodologies and all those, you can click that link Michael shared and you'll get all sorts of background information, very detailed about who we spoke to, why, sample sizes, etc. But I'm going straight to findings. So next slide, please. So what we found is that the policy responses over the last couple of decades have evolved to respond to that increased demand and decreased supply. On that demand side, we have seen a tighter targeting of eligibility to get into social housing. the rationing of then who gets in, so though you have to be of highest need. And as a result, we've seen this shift in social housing in Australia away from supporting the working class historically to supporting people who are not just in poverty, so a very low income, but also have complex needs. On the supply side, we have seen this sort of shift to try and increase supply without necessarily increasing stock. So that could be by moving people through social housing, which could be for all sorts of reasons. And we'll get to this in more detail during the presentation, but things like policy breaches, eligibility checking, alternative care. And so what you see on your right-hand side of your screen is the flow chart that the policies represent. It's this quite simple linear flow that the policy on paper is implying that there's a destination. So people go through the wait list, there's an eligibility assessment, they're checked against policy, and then there is some kind of exit pathway, is the presumption of these policies, the policies that we've found. Next slide, please. When we look at how those policies are implemented and we start to look at the detail of the policies within each of those jurisdictions, there are of course some differences, and we would expect that for different states and territories. But there are some commonalities, and operationally those policies all seem to imply this throughput pathway rather than recognising that the pathway is not necessarily linear. So that smooth flow chart rather than something that's more complex, which we'll also talk about in more detail. Secondly, the policy seems to be influenced, or the primary goal in those policies is about managing the social housing wait list, the primary goal, rather than the primary goal being about ensuring a positive outcome for tenants and their households. And you can understand this when you start to look at the things about the increased eligibility requirements and the emphasis on things like employment and transition pathways out. Finally, and there is a whole lot more detail around the different jurisdictional policies in the project that Abigail Powell led. But finally, while all of these policies establish these formal pathways and there are those similarities in this linearity of it, what happens in practice doesn't always match the policy. And I particularly like this quote because there are some incredible providers out there in social housing and public housing, community housing, state-owned Indigenous housing who are doing an incredible job, and their primary purpose is about positive outcomes for tenants and households. And sometimes there's a conflict between that intent, the way they work, and actually what the policies might be suggesting. So what I want to do now is just take a look at those pathways. So who's in social housing, who's getting in, who's moving within, and then what's happening in the exit cycle. So if we go to the next slide and start to look at who's getting into social housing, and we start with the how do you even join the wait list. The wait lists across all of our states and territories are, of course, shaped by fairly centralised application processes within each state and territory and fairly tight eligibility criteria. And the eligibility criteria are things you would expect: income and assets, citizenship and resident status, things like age, tenancy history, those kinds of details. But then the additional piece, which is all about tightening up eligibility, is giving priority to people and households with specific or more complex needs. And what specific and complex needs is defined as differs sometimes by state and territory, but we're mostly talking pretty generally about people with disabilities, people with physical and mental health issues, people who have experienced family and domestic violence, people exiting institutions, and importantly, those who are at risk of homelessness or are homeless. The experience in joining that wait list of tenants and also in what we were told by service providers is one of an enormous amount of information. This is a fairly complicated, in-depth process. Tenants are required to come up with lots and lots of compelling evidence to meet the criteria, and there is this sense of disinformation or miscommunication. So sometimes what tenants are being told or are hearing is miscommunicated between the intent of the housing officers. There has been a fairly long history of discrimination by some applicants, which has been found by other researchers, and that also appeared as part of our study. And then finally, the wait times in terms of that joining the wait list are really dependent on the availability of stock. They're marked by a whole lot of stress and uncertainty amongst tenants and potential tenants. And the reality, and if you look at the picture on the right, and I'll have a summary at the end of this pathway to where, what we've done is redrawn from the policy picture of here's a linear pathway, here's what it actually looks like from the perspective of the tenant and the tenant's experience. And so what happens is they go into this system, they demonstrate their criteria, they have that compelling evidence. You then either join the wait list with those other almost 200,000 people, or you are prioritised and enter the housing system. And you can see from our tenant quote from Tasmania that there is a lot of paperwork, there is a lot of stress, and even when you are of the highest of high needs, there's a lot of work that has to go into just getting to that eligibility stage. Next slide, please. So let's look at who's in social housing now. So this is the demographic profile of current social housing tenants. So thinking about all the people that have got into social housing in recent years and who are now currently in social housing. That targeting of those eligibility policies being ramped up, we see quite strongly in terms of shaping who that cohort currently is. So nationally across the three major social housing types, that's public housing, community housing, and state-owned and managed Indigenous housing, we see that most of the social housing tenants are female. 1 in 3 are over 65 years of age. Children, really tiny kids, 0 to 4-year-olds, make up an overwhelming proportion of those tenants. So they're 1 in 5 in public and community housing and 1 in 3 in state-owned and managed Indigenous housing. 1 in 10 of those households include an Indigenous member, and almost 2 in 5 households have a tenant with a disability, which is way overrepresented relative to the population. And so you can start to see some of those trends in terms of eligibility criteria starting to come up here. We can take this who's in social housing now and then say, well, here's the cohort of the demographics, but then who's actually getting in recent years? Who is the new, when we have new housing allocations, who are they being allocated to? So that's what I want to have a look at next. Next slide, please. So if we look at the, in between 2017 and 18, there was just over 37,000 new social housing allocations. Of those allocations, almost everybody fitted into that greatest need category. And that greatest need is all about you are either homeless currently or you're at high risk of homelessness. And you can see the stats there. So the overwhelming majority of people that are getting into social housing have layer upon layer of complexity. And so it is no longer enough to just be poor. You have to have also a whole lot of complex needs to be allocated social housing. And in terms of those 37,500 new allocations, the people, the tenants that ended up with allocations were there largely because of a bunch of issues. They were experiencing safety issues wherever they were currently housed or homeless or at risk of homelessness, disability or illness. They had significant caring responsibilities. Indigenous people were overrepresented, as were the very young and the very old. And so this is really about the priority criteria of the policies are being met in terms of who is and isn't allocated. And when we talk to tenants in New South Wales, Victoria, Tasmania, and South Australia, this matched up. Next slide, please. The tenants that we spoke to had multiple complex needs. They had housing histories and experiences of homelessness. They had all sorts of acute housing instability, things like sleeping rough in crisis accommodation, temporary spaces like boarding houses, caravan parks. And why they sort of ended up in social housing, or the trigger catalytic point tended to be some kind of immediate shift in their circumstances. They lost a job, their health got significantly worse, a disability increased, or accessibility issues came up. They had drug or alcohol issues, there was domestic violence, or some kind of relationship breakdown. And I think you can see by these three tenants in Tasmania, South Australia and Victoria, sort of the extent to which people are in very, very vulnerable situations before they get into social housing. And, you know, the first tenant, I've been couch surfing since my mum passed away when I was 16. For the last 12 years, I've been on and off everywhere. I haven't really had guidance to give me the stability and the support that I need. And for that tenant in Tasmania to have spent 12 years in very precarious housing situations and all sorts of other vulnerabilities to only just then be getting into a social housing and coming to the top of the wait list, you can imagine the complexity and the vulnerability that people are experiencing who are not getting access to social housing. And similarly, the tenant in South Australia. The third tenant's experience reflects sort of where the policies, I guess the housing officers, if you like, in whatever program they're involved in, are trying to support people who are particularly vulnerable to actually become a priority in that social housing waitlist. And this tenant in Victoria was told to try and store their possessions, live on the street to rough sleep, and then they would come up to the top of the list to get priority social housing. That is the extent to which we are short of having the supply of social housing that we need in this country. So moving on from getting into staying in social housing, next slide please. What we find when we look at who's in social housing and how long have they been in, there are a whole lot of people in public housing who have been there for a very long time. So 43% of public housing tenants have over 10 years of tenure. Now, this is not necessarily surprising if you think back at that. You have to get to this really high complex need. And when we look at what kind of other supports they're receiving from the government, most of those people are receiving disability or age pensions. The tenure levels are lower for the state-owned and managed Indigenous housing and community housing, but that in part can be in relation to timing of those particular opportunities, if you like. What we found when we spoke to the tenants across those 4 states is that social housing is offering that stability, security, sanctuary. It's home. And that sense of home is incompatible with policies that are this pathway model that promote this get in, stay, get out transition. And really are challenging around, if this is home and this is where I feel safe, then should I really be being pushed out? And one of the tenants from Tasmania said to us that the greatest thing about it is knowing that till the day I die, I'm safe. I'm coming up now to the longest I've ever lived anywhere. Up until then, the longest I lived anywhere after I was married was 12 months. After that, it was 3 months, 6 weeks, 9 weeks, 8 weeks, 2 weeks, 4 months on, 2 months off, 2 months on, 1 month off. It's a huge sense of security and safety, and I can plan. I can make decisions knowing that I've got 2 things you need, health and a home. And so we have that kind of messaging from our tenants showing how important social housing is to their lives. And we know housing is an important foundation to all sorts of other life outcomes. And on the flip side, we have operational policies that are affecting the extent to which tenants are expected to be on a housing pathway. And that might be reviews, continual reviews about their eligibility to still be in housing. It can be reviews around rental policies and changes to income, which is particularly difficult for people who are in precarious employment. So we see, you know, what's happening in jobs where you don't necessarily know if you're going to have hours next week. What is happening at the moment in terms of increased unemployment, it's a particularly challenging issue. Policies are also there around obligations, not just for the tenants, but the visitors to those tenants. And then also policies are there around household composition changes. The tenant experiences of this notion of staying in social housing, what the policies mean for them during that period, are really dependent on their relationship with the housing provider and the level of care that housing provider shows or does not show to those tenants and from their experiences. And what we saw is a mix in terms of the tenants' commentary. You know, earlier I put up a quote from a tenant, from a housing provider that reflected, you know, that putting the tenant first in terms of their outcomes. But we also got comments around like this, when tenants weren't actually feeling supported and more like numbers in a system and a policy waitlist that needed to be ticked off. Okay, so then if we look at moving within social housing, now in a context where in Australia, around 15% of the population moves at any given year. So in 2016 to 17, it was 15%, but it slightly changes, but it's pretty around that. Within social housing, it's tiny. So you basically get a place and you stay in that place. It was less than 2.7% for public housing and 2.5% in state-owned managed Indigenous housing changed their residential address within social housing during that same time period. The people that did move were mostly women, people living with disability who might have had changes to accessibility needs, those who are 55 years or older, and sole parents with dependent children. And those moves tended to be either initiated by a tenant or initiated by a landlord. If the tenant was initiating that shift, it was about changing their circumstances. That dwelling is no longer suitable for a whole bunch of reasons. But interestingly, it was also about issues came up with a tenant around issues with neighbours and not feeling safe and feeling threatened. One woman in Victoria told us that her child had been threatened with rape, and through fear of her and her family's safety, she put in a request to move, and that move did occur. As far as the landlords go, if they're landlord initiative, it's often about to do with that policy or portfolio or tenancy management. But in practice, trying to move within social housing is incredibly challenging from everybody's perspective, and it's for a whole bunch of reasons, but including around how that stock allocation occurs and how we deal with overcrowding and undercrowding. And you can read more about those things in the report. So thinking about that flow through pathway, so we've done stay and move within. Let's look now to exits in social housing. Exits in social housing, despite this policy framework that encourages that flow through in the policy, are super modest. So on average, we're only looking at around 7 to 8% of property turnover exits every year. It's very small. The exits are, again, tenant initiated or landlord initiative, and exits can be for a range of reasons and go to different places. You might be moving to aged care, for example. You might have been kicked out because of a breach to policy. It could be a tenant choice that is a positive choice, as in I have better opportunity, better support to move out, and I can now afford to do so. But it could also be negative. I don't feel safe here, and I need to go because actually being here is not okay. The policy levers around the exits tended to be things like selling dwellings to tenants, very tiny, provision of private rental subsidies or rental transition programs, things that would support clients with financial planning and other things to help them exit into the private market. But the biggest barrier to exiting, and this comes across in all of the data and also in all the statistical data, as well as the tenant experiences and the housing provider experiences, is there is a lack of affordable housing alternatives. So the big question with this research project is a pathway to where? And even tenants who did want to be in a position to move in the future, they just didn't see moving out of social housing as a realistic, genuine option, because there is no affordable, stable, safe alternatives. And as this Victorian tenant said to us, but where to? Financially, it's impossible. Even if I think about it, even if I want to, even if I need to get out, but where to? Nowhere. And when we do look at who does exit social housing and we look at the data, the exits aren't necessarily good. So some researchers looked at the HILDA data for 16 years, and over that entire time period, looking at all the people that exited social housing in that period, they found that 1 in 3 of those exits had gone to other tenures, which included really pretty precarious other housing situations, which would likely push those people into that sense of either homelessness or at risk of homelessness. And the other thing that we find with the data is tenants who leave often come back. And we see this cycle, especially with older tenants. And really, in sum, what this shows is that there is a lack of affordable and appropriate housing alternatives to social housing, and also a lack of support services in the community when people do move out, which increases pressure on the sector to actually put those supports in place. So I guess the concluding summary from all of this, next slide, please. 4 things. At the heart of the current social housing problem is demand for social housing significantly exceeds supply. The policy has responded with far too simplistic solutions around this notion of pathways, rather than being reshaped to deal with the complexity of the situation. 3, as a result, we see great inconsistencies between the policies and the pragmatic realities that tenants and housing providers are trying to deal with around traversing this pathway and this system. And finally, we need to rethink and reimagine what the social housing pathways and the social housing system might look like. And so in terms of going back to the policy flowchart on the left, and that simple piece around, the policy implies this fairly simple linear flowchart destination. The complexity of where all of this lands is the image on your right. And it looks confusing because it is. And imagine you are the tenant that is in, or the potential tenant that is in the midst of this. And really the summary of all the research is largely in here around this flow through. For those of you with visual impairment, I have done alternative text on all of the pictures. This one was really bloody hard, and I'm really sorry. If there's a way to do this better, I need some help. Anyway, I've tried. But basically it summarizes all the text, and the flow through is that basically you are on this really difficult pathway journey of going into the entry point around meeting eligibility criteria, having compelling evidence to do so. You either then flip down to entering into the system, or you join the wait list of those almost 200,000 people. If you join the wait list, remember you are still in a very precarious position, which could lead you back into the center of this diagram, which is homelessness. Once you are homeless, you're more likely to be allocated that stock. Remember, it's almost all of the new housing stock is going to those in greatest need. Then everything is reliant on your relationship with that housing provider. If you meet then additional complexities over time, you then are more likely to get back into the system and get allocated social housing eventually, after often a very long period of time. But you will be checked over time in terms of your eligibility. A transfer request within social housing is unlikely to happen because they're so tiny and not very easy to occur. And there will be policies around this that are, at least from a policy perspective, aiming to land on the pathway approach, which means that there are then a whole bunch of potential things around exits. And really, the bottom right of my picture should have a loop back to the start, because what we see is a number of those exits end back up in the system eventually. So it's super complex, and it should look confusing. And imagine being an individual trying to navigate this. So the implications of this from a policy perspective and a reimagining perspective, next slide please, is we, the authors of this report, think we need to reimagine a number of things. We need to reimagine the social housing pathways. And really what we want is for the question to change from how do we decrease the wait list to how do we improve housing stability, security and safety of the people who are the tenants on the wait list or are homeless, putting the people first, basically. And we need to address this really important question of a pathway to where. And the only way we're going to be able to do that is to increase the supply of affordable, secure housing. So from a social housing reimagining perspective, this then requires looking at providing social and affordable housing, not just for those with greatest need, once we have more supply that is, but also for people who are low and very low incomes, who haven't yet got all those complex needs. We have a real problem about not dealing with prevention, early intervention and waiting until you're about to fall off the cliff and then you get social housing. It's about accepting that long-term social housing is a legitimate and cost-effective way to provide social housing assistance, and it could be an endpoint. Doesn't have to mean that it's a flow-through pathway. Of course, these are premised on increasing the supply of social housing. One of the other recommendations that we make is establishing KPIs across the sector to ensure that the goals meet the needs of tenants and their households, not the goals of that policy intent. And better integration across housing and related supports. Did I just lose you? No, I'm back, good. My screen went blank for a minute, almost lost power. But I'm still here, good. And then next slide, please. So then finally, two other reimaginings. One, we have an issue for when people do want to go and exit social housing, and this is about the private market. So if you do want to exit the social housing pathway and it's appropriate for you to do so, how do we increase the supply of affordable housing in that private rental market? And coupled with that, how do we ensure that there's appropriate and resource supports for people so that they can actually stay successfully in that private housing system? And then, of course, there are more systemic changes that we need to think about around considering multiple pathways for people under different circumstances, perceiving and making sure from an implementation perspective and a policy perspective that social housing is a legitimate endpoint and not a through point, and re-challenging the understandings of how complex systems work in human services so that we don't end up with those really simple linear pathways, but actually people's lives are far more complex and trying to deal with that is much harder. And improve connections between the private and public housing system. So before I pass to Fiona, I want to end with a quote from a fabulous housing provider in Victoria and a shout out to everyone working in this space who has, particularly in COVID times, been working incredibly hard and doing amazing work. And as she very well articulated, housing is a security blanket like no other. It's a basic human right, and we all those of us who have it know it and appreciate it, and it's something that should be available for all of us. So thank you. Looking forward to the discussion.
Thanks, Kristy. That's terrific. Thank you for that, rapid fire, but still in-depth look at a really comprehensive piece of research. Just before I hand over to Fiona, I want to acknowledge we've had a little bit of issue with the slides keeping up there. They got jammed for a little bit there. After this webinar, we will load the slideshow up on the AHURI website as well as the video from the webinar, so you'll be able to look at just the slides if you just wanted to catch up on particularly the exit slide that didn't get much time. We'll probably also load that really complex graphic up as a standalone. I've looked at that one as an A3 page. Even at that size, it's pretty hard to follow. There's a lot in there. But look, having sort of done that little quick bit of housekeeping, thank you. Fiona, Caniglia, your comments, please.
I just wanted to also begin by acknowledging the traditional owners of the land where we are here at Kew Shelter, the Turrbal and Jagera peoples, and the contributions of elders past, present and emerging. I've tried to approach this response, by taking as read the really important, arguments and data in the report about demand and the challenges of supplying that demand across all sorts of layers of need, including at the very vulnerable end of need. If we just go to the first slide, it's such an important anchoring question. I think that this really core question embedded in the report is like a compass. It's the very thing that needs our focus, and it needs a sense of urgency, and that is how we improve housing stability, security and safety of people across the experiences of being tenants, of being on the wait list and being homeless. Next slide, thanks. I thought, and increasingly here in Queensland, we're in the midst of working in partnership with the sector and with the Queensland Department of Housing and Public Works on a number of areas of improvement and reform. It's a really important time in Queensland, and increasingly here, in those processes, we hear organisations and the funding body talk about the most important thing, that we find a way to make sure that we structure into all of these ways of improving things, the voices and the influence of people who need housing, who face vulnerability because of homelessness or the risk of homelessness. So I thought the report, was anchored so strongly in those voices too, it was just really powerful. And some of the things that really spoke to me that I think a reimagining of the future needs to kind of take thorough note of is the powerful picture it painted of home as a sanctuary, and the devastating examples of people being encouraged to escalate or deteriorate their own situation in order to meet criteria for assistance. And I have to say, with absolute honesty, in my own history of practice, that was a very regular challenge, that there was a sense of things needing to get worse before they could get better. And even how can the situation get worse more quickly, so there's perhaps an opportunity to reach out for the resource that's needed. And I think the other thing that spoke very loudly to me was just the challenge and the level of independence, planning and determination that's needed to find, get and keep housing. Navigation is an incredible challenge, and in fact that's an absolute struggle. And the report included a quote, I think, where somebody who felt themselves to be quite articulate and capable was struggling with that navigation process. And came into Kew Shelter with about a 10-year history with an inner Brisbane consortium called Under One Roof, which brought into their strategy of working to integrate service delivery among those agencies a frontline service integration care coordination group. And there were many examples of where even support workers or housing providers were reasonably certain that housing applications were in for a particular client, and it wasn't until our partners from the department opened up that application there'd be some outstanding bits of documentation, and perhaps the application had lapsed. It's even with the best of intention and people's own best efforts at self-determining and taking responsibility for their circumstances, finding, getting and keeping housing, that navigation is a challenge. In fact, it's an awful struggle sometimes, or even often. And I think the other thing that spoke quite loudly to me was the need for improved service integration, including sectors and services beyond housing and beyond the specialist homelessness system. So those things in terms of people's voices, I wanted to emphasise just as the basis for some of the things that I thought I might say now. Just transition the slide, please. So I think it is really important that we maintain a solid dialogue about vulnerability. I'm going to talk about rationing as well, but people who are vulnerable can miss out. So targeting might have some benefits in some ways. The issue we have though is that there's not enough supply, so the targeting becomes rationing, but I think some targeting of people in extremely vulnerable circumstances to housing products with appropriately integrated support is really, really important. The unintended consequences leave us with a system where it's really hard to prevent people's situations from deteriorating, or where people have to allow their situation to worsen, as the research shows. And the other impact is that the available support services are often putting significant time and effort into framing the person's situation to improve their chances of being allocated a scarce resource. How can we paint the picture so negatively that the person will be more eligible without telling lies or exaggerating, but how it's this area of skill almost in framing and persuading and having influence and advocating for that person so that they'll become more eligible. But in framing things so negatively as well, there's an incredible human and system cost. It's a system time cost. It's certainly a human cost to the tenant who's having to frame themselves so often in very negative terms. And it's also, I think, a vicarious kind of trauma to the workforce, because they are all the while trying to find the negativity rather than hold on to some of the strengths as well. But I really do want to emphasise, the importance of the researchers' conclusions around the fact that some people have such enduring vulnerabilities that they will require ongoing access to subsidised housing with support, or else risk further homelessness. And it's a false economy to think that those people somehow moving through in linear fashion presents us with a really great outcome that we measure, even though we're not terribly good at following those people through for long enough to really know what happened to them in their story. I think we need to absolutely build a system that has a clear commitment to those people. And we don't need to talk about the importance of targeting a certain type of product and support to those people as if that prevents us from talking about the other types of housing products and the other levels of support that might be needed for other household types who don't need that level of subsidy or support. We need a really very diverse number of toeholds, a number of access points, a number of options across all forms of housing and support to pick up on all of those differences. If we can transition the slide, thanks. So rationing as policy, I guess a key implication of rationing is a reflection of mine when I see quite a number of years of sitting at frontline care coordination group meetings trying to address homelessness with vulnerable people, is that one of the implications of rationing is it places all the pressure down on people who need housing or who are at risk of homelessness. And it also creates daily challenges for people working at the front line. So they're often the ones enacting these settings in practical ways in their own practice. So systemic and structural pressure down is less likely to ignite change, because the people who it targets are, they have relatively less power and they absorb most of the shocks, and yet they're in a weaker position to have power over decisions and resources. So I think one of the issues with rationing as a fundamental principle is that you end up with the pressure moving so far down in the system that the very people who might have something to say about that are the least enabled and empowered. And so you might also be building in a system that is resistant to change or resistant to iterative change as these problems emerge. Just the next slide, please. I loved the researchers' use of the word reimagine or reimagining. I think absolutely our challenge is to reimagine the future. If the data presented is so compelling, so and looking to the future and planning for the future. I remember urban planner Phil Hayward from QUT always talking to his students about planning for the future as an act of imagination. And yet we sometimes struggle to design a future that is unencumbered by existing or historical program designs and policy settings. And this inhabits us, not just in terms of our strict or read understanding of a policy. It sort of kind of weaves its way into us until we're almost not necessarily as deeply challenging of that as we might be. But if we had a blank slate and a clear sky, if our horizon was greater, I think then the boundaries of our organisations, our sector, our history, or the design of funded programs, what policy programs and service delivery models would we adopt, refine and measure? And we really need the space to have those kinds of conversations. And we also need, in reimagining the future, debates, but not debates that necessarily see really complex matters pitted against each other as a binary proposition. And I see, here, when I am engaged with the sector, I hear some strong arguments for how we just need lots more crisis accommodation. And I also hear people encamped in the view that we need lots of long-term housing. For some people, it's about sustainment, and other people talk about throughput. I think we need meaningful spaces for dialogue, like today, but also in the context of designing and implementing systems in our relative contexts where we can have these debates in meaningful ways and where we reach a resolution about what to do. Next slide, thanks. And, you know, it got me thinking when I think back on the years with frontline care coordination groups, but also working to the leadership structures of those organisations in a board, trying to hold the space for reimagining how people get into the system and stay if they need to. There's some real qualities and capabilities that we need in the reimagining process that I think we do well to create some space to discuss. I think it does need a bit of greater comfort with I don't know. We might need to be in a space of, you know, I don't know, but let's work it out. We need some meaningful dialogue about what the solutions are and how they can be brought about. And there are skills and attitudes that result in a clear intent and capability at working in an integrated way. So we talk about service integration all the time in the sector and between the sector and government, but working in an integrated way, there's a psychology to it, there is a sociology to it, there is a pattern of relationships that need to be structured to achieve service integration, and we're not necessarily individually, organisational or at a sector level geared to achieve the level of intense integration that's needed for some households. And I think it will require the kind of dialogue that helps us step away from frontiers, you know, or be aware of our frontiers and move to the wild frontier of saying, I'm not only going to inhabit the boundaries and interests of my organisation, I'm not only going to sit within the boundaries of my role, I'm not only going to think about existing funded programs or the history of funded programs that some people will have great attachment to. It's a willingness to think beyond those frontiers and challenge frontiers. So what would hold a workforce that could do that, and between the sectors as well? The capability in pressure up and escalation rather than pressure down in individual cases, but also through to systemic challenges. And as I said before, I think it really does require a beyond binary thinking approach to dilemmas and challenges. We need to strive for synthesis. We have to engage with the complexity and become more comfortable with complexity. It's third way thinking about the future that creates a future that's different from the past. Just the next slide, thank you. Nearly done. So, you know, I won't go through each of these points, but, you know, it's really important that in a reimagining that we lean heavily on what the evidence is telling us about what the solutions look like, and throughput doesn't get a lot of support as an evidence-led solution. So I also think that, you know, as long as we're using certain words like throughput and crisis and transitional and pathways, it does imply that linear journey that just doesn't ring true for a lot of people. So I think starting with language, a more careful, mindful, purposeful use of language, because language makes reality, you know, it starts to be what we bring about or bring into being. And, you know, I think that evidence is also saying that we need to build with people meaningful housing and support plans, but that's based on a really skilled assessment using good assessment tools. So rather than just a blanket blueprint in the form of a policy or a program, we need to start and really unpack what the person needs, help them articulate their needs, and build together a plan for that. Those assessment and planning processes are really critical. We need a system that holds that, and good assessment is quite a high order skill. It needs investment in training and support and supervision. Program specifications need more flexibility rather than being rule bound, and that's certainly the direction for Queensland, which is a really wonderful part of the leadership of our government to take us in that direction. But we need to recognise that some people are much more comfortable with rules. So even though there is flexibility already built in, you might have people interpreting things in a fairly rule-bound way, which again puts the pressure down. We need enduring support programs, a greater emphasis on prevention and early intervention, and continuity of care, I think, for people who are really vulnerable, rather than being passed between people who do this for 3 months and then people who'll do something else to you for 6 months. The continuity of care has got some good evidence behind it. So next slide, thank you. one of the things that Under One Roof grappled with when it started frontline care coordination groups is that some of the things driving the problem are to do with resources. There just might not be a house. So everything that Kristy said about the need to invest in social housing supply and other types of supply in the system is absolutely vital to success. So sometimes it's a resource challenge. Sometimes there'll be system elements, like how the eligibility criteria apply to you, how complex maybe it is to apply in the first place, or whether you can get access to housing that suits you and your family that you will reunite with in time for you to reunite with them. Things like that can sometimes be bound up in system elements. But, you know, Kristy's also talked about vulnerability, and people's circumstances can drive the barriers and the blockages to change. But a really important part, you know, of unpacking how we can hold the need to reimagine and bring about a new future is to include a focus on practice, because sometimes even with, you know, policy and program settings that are favourable, we're just probably not systematically enough investing in practice at the front line and at the management level, at the supervision level. People really need that support. I think there's so much complexity in the work that we can't neglect practice as well as a domain of influence. Next slide, please. For us at Q Shelter, in all the engagement we've been involved with in the last 12 months or so, it really does emerge that, you know, we need to be thinking about tenancy sustainment. And for some people, that would be sustaining a single tenancy, which is a social housing tenancy, because their vulnerability is so substantial. But it might also mean sustaining tenancies in other forms of tenure. And there's, of course, a column there that is about housing provision, which Kristy's painted very vividly in terms of supply. And that includes for us an effective private housing system playing its part. We also know that, you know, COVID-19, with the changes to legislation to support tenancies, favourable legislative, you know, settings are also really helpful to kind of improve the sustainability of private tenancies, and then institutional investment in rental, you know, products. All of these things are really, really important. There's a really important need to get the support side right as well for people who need it, and always careful to say not everyone needs a whole lot of support, but some people do need a whole lot of support, and some people will need other kinds of amounts of support. And that's across any domain, any wellbeing domain that could directly or indirectly impact housing. The other work that we're very involved with at the moment, our state government's invested in a service integration initiative in 9 locations, 12 care coordination groups that are place-based. You know, having regional frontline care coordination groups to support good practice that is integrated, we think is really, really important. But also place-based groups that capture leadership and the governance of those issues in places, so that you can build solutions, the architecture of solutions, and bring them into being quickly, lightly, in an agile way, place by place, and escalate those things centrally to the level of policy when it is a central policy issue. And then there's lots of enablers. There's assessment tools and shared IT platforms, informed consent tools with clients for integrated practice, supportive investment framework, funding contracts, etc., and workforce development, a critical enabler. Just the next slide, thank you. Nearly done, Michael. You know, for us, I think there's a real case. We talk here a lot in terms of our policy framework being about person-centred and place-based work. Well, frontline service integration groups have really proven to not just help deliver integrated service delivery outcomes, preserve existing tenancies, or help people exit homelessness, but also they are a vehicle for workforce development. So it's not just formal training that develops people, it's sitting in a room full of peers, becomes a community of practice. The things that you might be going to do get a bit tested, but in a supportive environment. And you also pick up other ways of doing things, and you leave with probably more resources and commitments from other services as well around that client. Regional leadership groups, as I said, I think we need regional leadership groups with decision makers and resource allocators to solve problems, and they need to be at the right level to escalate policy matters and program design matters in an iterative, responsive way, rather than intermittent or occasional large-scale reforms. You know, we wait a decade or 2 decades to discover all the problems and then mount a very big reform process, when in fact, perhaps what we really need is the structural arrangements that allow us to achieve reform and improvements. And this reimagining, which is such a great word, in a more iterative, responsive, agile way. And then I think central leadership as well to solve those matters of policy and program design in real time rather than, as I said, waiting for other. And just I think there's one last slide, perhaps, if I can remember correctly. Oh, no, that's it. Okay, thank you.
Terrific. Look, you've both covered a lot of ground. There's a lot of material to work with there, and so predictably we have quite a few good questions coming through already. The instruction is there on the screen for you on where to access the questions tab in the GoToWebinar software. I might just start though with a couple of or 2 or 3 questions of clarification really from the research and its findings. And I suspect the answer to this first one might be it depends. But the question is coming: how long does it take for a request to move to happen? You know, if a social housing tenant asks to move, how long do they wait? Kristy, do you have observations on that?
It really does depend, and we didn't track that specifically in terms of, like, you know, the average time for this number of clients. In terms of the tenant interviews, it really did depend on the jurisdiction. It depends on the availability and supply of housing. Like Fiona said, it depends on where the person is based and where their support networks might be. And, you know, you've got a childcare centre that you're using or a school or whatever. So there are a whole lot of issues. But, you know, I'd have to double check the research. And Michael, you probably know this, but the average wait time for public housing used to be like 10 years. What's the latest on that?
I'm not sure that, well, the figure varies nationally. In different jurisdictions, different wait times, and for that matter, within jurisdictions, you know, in the major centres or more regionally, it's variable as well. Fiona, you probably have some comment there.
Oh, just that, you know, through the care coordination groups, it's really, sometimes the need for a transfer does come up, and with the best of intentions and lots of focused effort, community housing providers and the public housing authority alike are struggling to always accommodate those transfers, just because people aren't waiting to fill vacancies. We're trying to get the most efficient vacancy turnaround times possible so that you don't have empty bed nights and people are less homeless, but also so that the viability of housing is more sustainable. So it's not always easy structurally to find the resource that you need to do it. And you know, and sometimes I think, you know, we have seen a number of people present at care coordination groups seeking a transfer, and a little bit of unpacking might mean that you could actually mitigate the situation differently as well. So sometimes the request to help people move becomes a better understanding of what the options might be, which might also look very closely at how you sustain that tenancy rather than necessarily have to move, because sometimes the horizon of a tenant with a particular problem, and the best example I can give was someone who had a small hole in their wall, who felt really paranoid about the hole in the wall, and because it was non-urgent maintenance, it wasn't addressed very quickly, and that was presented as a need to transfer or move. Whereas when we got dialogue between the housing provider and the support provider, based on that assessed need, that tenancy was absolutely sustainable. So it's very important that people can transfer when they really need to because of safety and other issues. But there are some times when really high quality dialogue within the system can integrate a response that doesn't necessarily involve a transfer.
There's a couple of questions looking to get further breakdowns of the people on waiting lists and living within social housing in terms of, you know, demographics, young people, those with care experience and so on. There's probably quite a few questions actually now as I look at them, some of which are probably best answered by looking to the research reports that we linked earlier on the AHURI website. Yeah. But Kristy, did you want to make comment on that though?
You're breaking up a bit, Michael, on the question, but I think it was about demographic differences in wait lists.
Yeah.
So there's a lot of statistics in the report, and I know I did flood you with quite a few in the presentation as well, but there is, like, you know, the number that I originally had before I cleaned some out, there are a lot of statistics around, and where I put up things in the presentation pack, like people with disabilities and women, Indigenous people with disabilities. In the report, all of those things have statistics against them, and there's a heap of statistics against demographic groups for that the waiting group, for the for who's in, and then also the allocations, and then also the exits. So you can definitely drill into all those things in the big inquiry report. And if you're interested in more tenancy experiences, that's if you look at Kathleen Flanagan's project that she led, has some really fabulous work in there. Kathleen and team did a great job on that. And if you're interested more in the policy, more detail around the policy and jurisdictional differences, that's in Abigail Powell's report.
Just had someone apologise for asking a stats question. It's okay to ask stats questions.
Particularly to a research
webinar. Sorry.
No, I just said particularly to a research webinar. You're among friends.
Absolutely. There's a couple of good questions really around tenancy management practices and antisocial behaviour and how those are playing out. You know, whether sort of sustaining tenancy approaches are effective in that sort of space. Did the research come to any conclusions around that?
There are bits and pieces around tenancy management. So there's obviously a lot in the policy perspective around how tenancies are managed and eligibility pieces. I think where you start to see the tenancy management things play out is, so that example I gave you of the woman in Victoria, and, you know, like the people's lived experiences of what's actually going on and what happens when I, you know, if you think about people's normal lives, right, and you think about tenancy management, so there's a piece around tenancy management around how am I supported, or how am I fulfilling my obligations as a tenant that people will understand in terms of, you know, how you live. But then think about people's lives and think about, you know, all of a sudden you have a disability and you can't get access, you can't use your steps anymore. You think about, you know, somebody moves in next door and all of a sudden your rights are being compromised in terms of you don't feel safe anymore, or you're worried about your child's safety, and then you've then got to talk to the provider not just about your own tenancy, but actually what else is going on in the context of the building you're in. You know, there are you know, still plenty of old style housing where we know that the statistics show that you know, they're not actually up to scratch in terms of some of the safety and other requirements. You know, housing that has really low level balcony that might have little kids housed in it, that is like, you know, 1 story up in a regional town, for example. There's all sorts of those complexities around, you know, how do you manage tenancies in the context of people's lives, and also think about what happens when your family status changes. And that was a big issue, you know. So, you know, for those of us who are able to maintain our own housing through renting or home ownership or whatever, we can choose to have a partner who moves in, who doesn't. You know, we might have another child, you know, grandparents pick up kinship care. There are all sorts of things that happen where people's lives change in terms of the household expanding and shrinking. And we get to then choose to what extent does that mean that we change households or not. The policy tenancy management, other side of it might be that actually you're no longer compliant with your piece, or all of a sudden you've got an overcrowding issue that the tenancy managers like Fiona have to deal with. This is like a really complex space, and there are a lot of issues throughout the research that deal with this tenancy management and how that reconciles with people's lives. Fiona, do you have some stuff to add on that?
Look, I just think it is really important to talk about both supportive tenancy management and, you know, what differentiates the delivery of social housing from the delivery of other types of housing. And, you know, arguably even in the private rental market, you know, we're working with the REIQ on equipping property managers with a better understanding of domestic and family violence, for example. So, you know, I think we need to build the capacity of all property managers, including our own sector, in what is supportive tenancy management, because where there's high vulnerability, that's really important. But it is one of the consequences of concentrating high need people together, that the cost and the number of challenges in supportive tenancy management in congregate, you know, well, not necessarily congregate living environments, but multi-unit developments, requires an intensity of practice and a focus and a preventative approach that stitch in time to prevent a serious deterioration that causes a neighbour problem or causes another tenant to have a complaint or be prevented from their own quiet enjoyment. There are complex behaviours to manage. And then I think the other tier, in addition to supportive tenancy management and support, is tenant engagement and participation. How life gets better in social housing is often through the recreational and other connecting things that people can do to experience a community of belonging. And broader community engagement is critical as well, because when there are issues, they can easily spill over into negative community sentiment. So I think that's part of that integrated tenancy sustainment, talks about community and tenant service user engagement as part of the anatomy. I think there's a number of moving parts that will improve the sustainment of tenancies from that perspective, from the perspective of the impact of vulnerability and some behavioural issues. I've got to say, there's a lot of wonderful practice out there. But as an industry and peak body, we want to do so much more to support that practice, in terms of learning and development, workforce development, communities of practice. But of course, the policy settings can help or hinder, and we're always working, about, how to ensure that the policy and program settings are as supportive and enabling as possible.
So we've got a really interesting comment coming just in the last couple of minutes, actually, that I'm going to jump to, that is really challenging us on using the term social housing in this discussion and asking whether research detected differences in accessibility to exits from movement within public housing or community housing. Are they the same experience, or are there different experiences in those two tenure forms? So I'm really interested, Kristy, whether that was something that came up in the research.
Look, we did interviews across 4 different states and territories, like I said in the presentation, and then with a bunch of different types of providers. We have to be careful with the qualitative research to draw conclusions about who's better or who's worse. And really what it kind of came down to is, what was that relationship like with that provider? And I guess that goes to some of Fiona's points in her reflection piece or response piece around that frontline provider is really key to the experience of the individuals. And sometimes that was amazing with public housing people, with community housing people, or with state-owned and managed Indigenous housing. But I guess what we can't conclusively draw that one is better or worse than another from this particular the sample that we had. And we spoke to around 76 people across those 4 different states, and with all from different age groups, from different cultural backgrounds, with and without disability. So really what we're trying to understand was the tenant experience more broadly, rather than comparing a particular type of provider.
I think the other thing that you just reminded me to I think needs to sort of be remembered is that not everybody in either public or community housing, or private tenancies for that matter, have a support guarantee. Like the other thing that is challenging and is rationed is where the support comes from and the level of intensity and how enduring it is. And for some households, that's really important. So, if you've got one household really struggling in any tenure and they're not getting enough individual support across whatever wellbeing domains we might identify, that can be the critical success factor, or otherwise that prevents the sustainability of tenancies or the breakdown of a whole neighbourhood set of relations. So the factor of support is really, really important, because the role of supportive tenancy management doesn't allow for that really, really intensive shoulder-to-shoulder approach to support where vulnerability is high. And there are arguments that it shouldn't, that otherwise people's lives are institutionalised, so, and I know that's a debate, but the notion of a support guarantee for people who need it would go a long way to the sustainability of some tenancies.
That's really interesting, Fiona. I like that support guarantee. And one of the things that did come up from providers is that notion of those supports are such a finite resource as well as the housing. So it's not just the housing people struggle with, it's the how much support can you get. And it's all well and good for researchers like us to go, hey, do better integration. But actually, how do you implement that on the ground when those resources are also finite and everybody else is stretched? And, you know, Fiona sort of talked about, I really like that idea of that integrated regional kind of leadership group. And I'm not using the right language that you use, Fiona, but that kind of notion is really clever. And I think part of that would be, how do you resource that appropriately? Because there is the piece that Fiona mentioned around, you know, the skills that needs. It also means that people need to have the resources available to put those supports in place. And it also has to be funded. So you've got money to actually come together. You know, in previous research where we've looked at integration, for example, between mental health providers, disability support providers, not-for-profits, and housing around supporting people with really severe mental illness to have stable housing, you know, having funding for the collaboration, not even and the resources to actually do the support is key. And evidence-based to actually make that successful. And that's really important because these people are so stretched.
They are stretched. You know, we are very, you know, pleased our state government is invested in regional care coordination groups, and that's, you know, raising the whole opportunity of how leadership relates to those frontline groups so that there is a point of escalation for things that come through the frontline that frontline workers just cannot influence on their own. They need leadership. They need the people with delegated authority to advance a solution with and for them. So resourcing is really important, and we're very proud and very thrilled to be involved. And you know, pleased our state government has not only said it's a good idea, they've legitimised the role of structural arrangements to hold the sector together by funding regional care coordination groups. It's a great initiative, and we're looking forward to our role in its evaluation and you know, action research to sort of see how that area of practice can be strengthened. I think the point about support guarantee and resources is important. It actually causes tension because with housing provision, you count the number of units, you count the number of people who need a unit, and it's a simple addition or subtraction. But in support, we sometimes think the rubber band can just keep stretching. So the tension of wanting to reach out and get support. But, you know, we know that healthy ratios in support arrangements are critical as well. Otherwise, you don't get the level of appropriate assessment, the level of appropriate attention. Sometimes people need touch points several times a week to sustain their tenancies, and that's not always easy to achieve. And there's definitely a factor in that that drives tenancy breakdown.
I think on that note, the tenancy breakdown piece, the other thing that came up in the research is that transition from, let's say, you know, you've hit that, you hit the eligibility, you're at the top of the list because you have so many complex needs. You come from a homelessness service system that has crisis and intensive case management support around you. Now, that's not to say those people are also stretched. We know that the demand for their services and the need is not being met because there's just too much demand. So they also have a supply problem. But people are sometimes coming in from that environment, then moving into social or community housing in whatever format. And those organisations don't have the same resources and supports in place. And so that sense of how do you step from, you know, the homelessness system into a housing system and make sure that, Fiona's point, that your tenancy is successfully supported, and what kinds of supports do you need in place to make that a success and not end up as one of those people whose breach policy gets kicked out, you're back to being homeless and you're part of this loop problem.
You know, we might be looking, you know, to a future of trying to reimagine what the relationship of housing is to support. And we've got an existing specialist homelessness sector, which is so important. We've been really working, you know, through engagement with the sector to realise that there's a lot of support in the sector for a much more integrated relationship between SHS, the provision of social and other types of housing, as well as other really critical support systems like substance use and mental health is huge, disability, NDIS, all of these things need thorough integration so that we probably need to break down our siloed view that homeless people get helped by SHS. Some do, and some just bypass that system through other support systems. But I think that service integration, that wrangling of those different resources to come up with a an absolute blueprint for what will help that person, with them driving that with us, you know, I think is really important. But we've got to recognize. Sorry, no, you're right.
I was just going to wonder two things, but one, you know, you're rattling off that list. The other group that's really important around integration, and I'm going to make, you know, we're just adding, but it's important, is aging. And it's almost like thinking differently about, you know, if we think differently about the world, instead of it being about, you know, the housing system or the homelessness system or public housing, we think about people and what kind of society we want for people in terms of their lives, and what kind of society we want to live in, and how we reimagine that. And you take aging, for example, you know, you've got about 1 in 3 people in social housing are 65 years or older. So the intersection with that, with the aging service sector is enormous there. Then you think about aging in terms of the challenges that we've got with aged care and COVID, and the workforce and everything else that's going on around there. And you think about the challenges of aging in home. And so how do we put better supports in place for people that are aging, no matter where you might be aging? It's sort of like flipping the thinking. So it's less about the system and more about the individuals we're trying to support. It's challenging in practice, but it's an interesting kind of flip.
Look, it's really important to mention ageing, because even though those stats surprised me actually in public housing, they shouldn't have probably, but they did, the proportion of older people. But now we have this emerging cohort of older people who don't have high and complex needs, they just don't have affordability, and they're struggling to get into anything suitable. So that's another cohort that, but then the other thing is about people who are in sustained rough sleeping and other forms of very precarious living arrangements, have lower life expectancies. I think there's some research in San Francisco that's based on the premise that homelessness is actually biologically catastrophic. So, you know, we also see through the care coordination groups that you don't often see a lot of older people, and we've wondered, we don't have the data, but we wondered whether that's because they age into aged care. That would be the best scenario, or they just don't age because they're sicker and they have premature mortality. You know, so age is really important. It's a real dimension to manage and think about.
Absolutely. I want to come back to some of the questions we've had, and I'm going to pair a couple of questions here that I guess take different angles on exits from social housing. One of our international audiences asked about the role of evictions in Australian social housing, and to what extent are exits from the system eviction driven. But I guess pairing with that, there's another quite a good question there. So asking about, well, what about the positive stories? Are there positive stories of people sort of moving on from social housing into private rental or home ownership, or is it all negative? Kristy, how did the research go in those spaces?
There's a lot, and I'm actually just pulling up a piece of research that we've cited in our research in the report. So give me a second. There are some positive exits. I think the key thing is, though, the challenge with the exits is it's very hard for them to be positive when you go back to the start of who's getting in. As in, if you've got all of this level of complexity and you require all of this type of support. So I'm very, very poor, I don't have a job, I've got a disability, I'm aged, and in a climate of, you know, we're now in a climate where work is even less likely than it was before, but you still were in a climate of struggling around trying to get a job in with all of those things, or you might not be eligible for one. It becomes very difficult. There's a quite an interesting piece of research by Baker and Leishman. That's a new AHURI report that also came out in 2020, and they looked at a very big data set that compared the demographics of the type of housing people were in with the demographics of the people, and also things like what benefits they were receiving. And they looked at exits of who was coming. They looked at who was stable, so who was in there for 10 years. They looked at exits that were in and out, new entrants out to in, people who left briefly, and people who were out, back in, and out again. So the exits are really complicated. It's not as simple as that linear piece. And I guess that's why it's not that linear pathway. In terms of the exits out, so this could be the ones that are likely to be positive exits. But to Fiona's point, what we don't do very well in this country is longitudinally follow these individuals and say, are you okay? And to, you know, do you have safe, stable, affordable, secure housing? That's key. But the ones that were more likely to exit in and out in this data set across 10, they looked at 10 million people over 10 years. So 14%, so that's about 1 in 7, if my maths is going to work quickly in my brain, they tended to be 10 years younger than the average age group. So that their mean age was 50, which is still older than you might think, but actually remember a lot of them are over 65, and that's mean. They were 2 in 3 of them were female, 12% were Indigenous, 28% were born overseas, 2% were refugees. So they were most likely receiving unemployment benefits. So you know, there's a group of people who are younger who possibly need some shorter term assistance, shorter term stable housing to get themselves into appropriate training or support or workforce support, who can then exit into the workforce. And, you know, of course, where people want to make choices, we want to give people equity of opportunity around those positive pathways. I think that the challenge at the moment is that historically, you know, we had in Australia, public housing was set up around, you know, you could be a working class family and have support to have affordable housing, and, you know, this sense of social mobility. Because of the complexity of the client group now, it's sort of it's slightly less likely. Fiona?
Well, I think it's right that we probably don't know as much as we could know about the trajectory of people who leave social housing, or when any tenancy breaks down and where people are experiencing a measure of vulnerability. I do think that kind of data is very helpful and important. I think the quality of transition is what's really important, and, you know, within the framework of tenancy sustainment, you know, we've playing with ideas about not just thinking about sustaining one type of tenancy. If a transition is a really good thing for you and you want to progress into something else, then what will make that transition really successful? Because we know it's expensive if you are on a lower income. We know that other vulnerabilities might come to the fore if you're transitioning, you know, schools, or, you know, there's all sorts of things. So, you know, what does a successful transition look like in order to contribute to the long-term safety and security of a housing outcome, I think is really, really important. That's an area of practice, and I think we need to get role definition right with that as well. Who can help with that? And how does a person going through those transitions even reach out for help? A lot of that might happen quite silently, and with a measure of struggle. I just don't think we fully know. I absolutely acknowledge there'll be many people who can transition without other interventions, but I think some people have a rough landing because we're not necessarily helping that transition to be as successful as it might be.
A whole ton of other questions we haven't been able to get to, and we won't be able to get to, around tenancy skills development, financial counselling as part of wraparound services, concentrations of disadvantage in social housing when we have enough social housing to create a concentration, mind you, negative gearing and tax reform, disability and accessible housing and universal design, a whole lot of other topics there that are probably outside of the scope of this research and this conversation, but I would encourage people to look at the AHURI website, where there's a wealth of information around all sorts of topics like those. But I'm afraid time has beaten us again, and it's time to wrap up the webinar today. So look, thank you very much, Kristy and Fiona, for your presentations and the wonderful discussion today. It's been I think, a really rich conversation. Our next webinar is coming up in a couple of weeks, and the official invitation will be arriving in your inboxes tomorrow. So I do hope you'll join us on Wednesday, the 2nd of September at 2 in the afternoon Eastern Time, where we'll be joined by Professor Robin Dowling from the University of Sydney, who'll present findings from the final report on the affordable housing in innovation-led employment strategies, looking at the smart cities kind of concept. And a quick reminder that we'd like your feedback by completing the short survey that we sent to you later on today. And if you'd like to share this webinar with any of your colleagues, it'll be on the AHURI website in the coming days, as will the slides and other material. So until we see you again, Thank you for joining us, everybody. Thank you, Kristy. Thank you, Fiona. And we'll see you all next time.
Thank you, Michael.